All right, a recent breakthrough in mental health care treatments could revolutionize medical responses to a growing crisis in America. Physician and CEO of Kind Health Group, Georgine Nanos, joins us now to share more. Hi, Georgine.
Hi, Allie. Thank you for having me.
So talk a little bit. Obviously, mental health is quite a topic these days. You hear about it constantly, but there are some breakthroughs in treatment, correct?
Yes, and accelerated TMS is definitely one of them.
So talk a little bit about what that is.
Yes, most people have probably not heard of it. Let's start with what TMS is first. So TMS stands for Transcranial Magnetic Stimulation. And as soon as I say that, I like to say it is not electric shock therapy, because people think that that is associated. It's entirely different, and it uses magnetic field pulses to penetrate deep areas into the brain and get to the areas in our brain where our depression and anxiety centers tend to lie. And what it does is, oftentimes when we are depressed, anxious, stressed, we form these negative loops in our brain pathways, and it's hard to get out of those loops and get unstuck. And so what TMS does is create positive new pathways in the brain. It actually establishes new connections to put your brain in a positive, create these positive pathways, so that when you are faced with a challenge or a stress, instead of going to that negative feedback loop, you can have more, it expands your brain space to go to those positive areas. And TMS has been around for a very long time. It's been studied for now over 30 years, and it's been FDA approved for the last 15 years. And the reason people haven't really heard of it much till now is because the way it was originally delivered when it was first approved, it was done over the course of 40 or 50 days. So patients would go to a TMS center, they'd get the treatment, which takes, back then it would take anywhere from 15 to 40 minutes, and then they have to come back every day for 50 consecutive days, which is pretty hard to do outside of a research institution. And so people weren't really following through with that. Well, a few years ago at Stanford, a group of researchers came together to study if condensing that protocol to 5 days would be as effective, and it was actually much more effective. And that became known as the accelerated or Stanford protocol. And that allows the treatment to, we do 40 treatments over 5 days instead of 40 treatments over 5 to 6 weeks. So it's really changed the game for administering the treatment.
Well, and I think in a day and age where you're hearing so much about the mental health crisis, I mean, this is just another option, and I'm sure something that now you're looking at a little bit more seriously.
Yes, it's the nice thing about it is that it is completely safe, and there are no long-term side effects, which is not something I can say about really anything else in medicine. So to have that option for people is really powerful, and it really helps patients who are going through acute mental health crises. I've had people come to me on a Monday telling me that if this doesn't work, they'd be killing themselves on Friday, which is absolutely horrifying, and we can take them out of that suicidality and keep them in remission for a long period of time. So it's really an incredible option. It's really a breakthrough.
Yeah, I'm sure nice to have a tool that you feel like it's helping people.
Yeah, exactly.
All right, well, Dr. Georgine Nanos, thank you so much for coming in this morning. We really appreciate your time.
Thank you.